Hi everyone, welcome back to Path Demystified, and today we are going to continue with our series of cell death pathways. I'm Dr. Shubhika Sachdeva, MBBS MD Pathology. So our topic for today is a very easy one, that is necrosis. So, what is necrosis? Necrosis again is a type of irreversible cell death. But unlike apoptosis, necrosis is always a pathological process which occurs because of a severe injury. It is characterized by denaturation of cellular proteins, leakage of these cellular proteins through the damaged membrane out into the extracellular space, thereby eliciting a host reaction or inflammation, and finally digestion of these lethally injured cells by lysosomal enzymes. So, what are the causes of necrosis? It can occur in cases of ischemia, exposure to microbial toxins, burns, chemical or physical injury, or in settings of conditions like pancreatitis, where there is leakage of active proteases from the cells and damage of surrounding tissues. Okay, so what happens in necrosis? So when we have a lethally injured cells because of any of the above mentioned causes, these injured cells will release certain specific substances which are called as damaged associated molecular patterns. Now, what are the examples? It can be ATP, that can be because released from damaged mitochondria, or uric acid, that is because of breakdown of DNA, or any other molecule which would normally be confined in a healthy cell. But now that the cell is injured, and its plasma membrane is ruptured, it will release these substances into the extracellular space. When these are released into the extracellular space, these are recognized by macrophages, and when they are recognized by macrophages, they will elicit or trigger phagocytosis and cytokine production. This cytokine production will lead to inflammation, and because of this inflammation, there will be release of certain proteolytic enzymes, and combination of phagocytosis and the enzymatic reaction will lead to the clearance of the necrotic cell from your body. Now, an interesting fact. Interestingly, these intracellular proteins which are leaked from the damaged cell membranes ultimately will reach into circulation. Right, and when they are in the circulation, we can detect the levels of these intracellular proteins in the blood by certain blood tests. So, the detection of these intracellular proteins in the blood serves as biomarker for several clinical conditions, and is an indication and is a very good indicator for tissue specific cellular injury. For example, in case of myocardial infarction, cardiac muscle cells will release certain cardiac specific variants of contractile troponin, which can be detected in blood of that patient within 2 hours. Similarly, in case if there is a bile duct epithelium injury, it will be marked by a increase in serum levels of specific isoforms of enzyme alkaline phosphatase. Or if there is a hepatocyte injury, we usually do blood tests like LFTs, right? So hepatocyte injury can be detected by increase in levels of transaminases such as SGPT or SGOT. Having seen what actually happens in necrosis, how will you recognize it under the microscope? So, what are the morphological changes? So, the cell will become more pink. That will happen because of loss of cytoplasmic RNA, and somewhere because of accumulation of denatured cytoplasmic proteins inside the cell. The cell will have a very glassy appearance because of loss of glycogen particles. Also, the cytoplasm will become vacuolated, and this is characteristically called as moth-eaten cytoplasm, and there will be presence of myelin figures which are recognized as large walled phospholipid precipitates. Also, you can see that some of these cells don't even have a nucleus. You cannot appreciate a nucleus properly, so there will be loss of nucleus as well. And we'll study the nuclear changes in necrosis in further slides, but just appreciate here that there are some cells which do not have a nucleus, whereas there are some cells which have a very dark basophilic condensed nucleus. So we are going to study all of this in subsequent slides. So what are the nuclear changes? Nuclear changes happen mainly because of breakdown of DNA and action of endonucleases on the nucleus, and these can occur in three ways. First is pycnosis. What do you mean by pycnosis? Pycnosis, basically what happens in pycnosis is there is chromatin condensation. You can see how small and shrunken the nucleus has become, and there is increased basophilia, that is, it has become more blue or purple in color. This when this pycnotic nucleus loses its nuclear membrane and the nucleus undergoes fragmentation, it is known as karyorrhexis. And finally, there is dissolution of the chromatin, there is loss of basophilia, and this is what you call as karyolysis. And either of these three patterns can lead to nuclear dissolution and ultimately leading to a anuclear necrotic cell. Now coming back to that image in the earlier slide, now you can see that this nucleus is so small, it is so shrunken, and it is so blue in color. So this is what you called as pycnosis. Now you can see here that there is fragmentation of the nuclear. You can appreciate karyorrhexis, and certain cells don't, you cannot even appreciate a nucleus. So this is what you call as karyolysis. See under an electron microscope. Under an electron microscope, you will see that the plasma membrane is it has discontinuities in it. It is disrupted, and there is swelling and fragmentation of all the organelles in the cells, and there is marked dilatation of mitochondria, and this mitochondria has large amorphous densities in it. There is intracytoplasmic myelin figures, and denatured protein can also be appreciated on electron microscopy. A quick recap of what we just studied in the previous slide. We have a normal cell here. Now this cell has undergone severe injury or insult. Now what will happen? You will have swelling of the endoplasmic reticulum as well as the mitochondria. You see the size has increased. There will be presence of myelin figures, and there will be membrane blebs. But at this point, the plasma membrane has still not been disrupted. This injury is still, you can recover from this. When there is progressive injury, the insult to the cell has not stopped. There will be breakage of plasma membrane, nucleus, and there will be leakage of the intracellular proteins out into the extracellular space, eliciting an host reaction, leading to inflammation. And the now, because of progressive injuries, there will be amorphous densities in the mitochondria. Now, comparing this with what we studied in apoptosis. In apoptosis, there is condensation of chromatin, there will be membrane blebs, but the intracellular proteins will not leak out. Instead, they would form apoptotic bodies. What are apoptotic bodies? These are membrane bound bodies which are released from an apoptotic cell, and there will be cellular fragmentation, and progressively the cell will be taken out of the body via phagocytosis. Quickly revising differences between necrosis and apoptosis, I would suggest you to fill this table yourself first and then see. So, what is necrosis? It is a cell death with degeneration of tissues by hydrolytic enzymes, whereas apoptosis is a programmed cell death. Both of them are irreversible, but here in necrosis there is degradation of tissue by hydrolytic enzymes, whereas apoptosis, it is a programmed cell death. So what will happen to the cell size? In case of necrosis, the cells will become large, there will be swelling of the cells, whereas in case of apoptosis there will be shrinkage of the cells. So what will happen to the plasma membrane? In necrosis, the plasma membrane will be disrupted, whereas in apoptosis it will be intact, the structure will never be altered. In necrosis, the nuclear can show either of the one of the changes, such as it can be pycnotic, it can show karyorrhexis or karyolysis, whereas in apoptosis it will only be fragmented. There will be inflammation in necrosis, whereas in apoptosis there will be no inflammation. And necrosis, the cellular proteins will be enzymatically digested by lysosomal enzymes and will elicit a host reaction because of leakage of these cellular proteins into the extracellular space. Whereas in apoptosis, the cellular proteins remain intact and are only released in form of apoptotic bodies. Now, coming on to the patterns of tissue necrosis. The first one is coagulative necrosis. So what happens in coagulative necrosis? In coagulative necrosis, the injury will denature the structural proteins as well as enzymes, and thereby it will block the proteolysis of dead cells. And when this proteolysis is blocked, the cells will appear intensely pink. Ultimately, these necrotic cells are broken down by lysosomal enzymes and they are removed by phagocytosis. Characteristically, the architecture of dead tissue is preserved in coagulative necrosis. The most common cause of coagulative necrosis is ischemia caused by obstruction to the vessel, and a localized area of coagulative necrosis is called as an infarct. Here you can appreciate a wedge-shaped infarct, a yellowish colored infarct in the kidney. On microscopically you can appreciate that this is the normal part, right? And this is where you can see intensely eosinophilic pink cells and infiltration of inflammatory material inside it. Now the second is liquefactive necrosis. So what happens in liquefactive necrosis? In liquefactive necrosis there is focal bacterial or fungal infection. These microbes stimulates the production and accumulation of inflammatory cells such as leukocytes, which will release certain enzymes and lead to digestion of dead cells, leading to transformation of the tissue into a very viscous like fluid. So in this picture you can appreciate that you can see this necrotic material, creamish yellow material, and microscopically you can see that there are so many inflammatory cells. So this is what you characteristically call as pus. Liquefactive necrosis is very characteristically seen in hypoxic injury in central nervous system, that is CNS. The third one is caseous necrosis. Caseous means cheese-like. Cheese is whitish in color, correct? So here you can see friable white appearance of the necrotic area, and microscopically you can see there is no structure to the lice cells. There is amorphous granular debris and it is surrounded by a rim of inflammatory cells. Next is fat necrosis. Now we are going to study fat necrosis with a characteristic example of acute pancreatitis. So what happens in acute pancreatitis? There is release of activated pancreatic enzymes into the parenchyma of the pancreas as well as into the peritoneal cavity. These pancreatic enzymes or lipases liquefy the membranes of the fat cells in the peritoneum, which leads to the production of triglyceride esters. These triglyceride esters are split by pancreatic lipases and lead to the generation of fatty acids, and these fatty acids combine with calcium and give rise to chalky white areas, which is also called as fat saponification. So in this picture you can see these chalky white areas. So these are fatty acids combined with calcium, and microscopically you are going to see shadows of necrotic fat cells with a very basophilic calcium deposits, and there will be inflammatory reaction. The next one is fibrinoid necrosis. Fibrinoid necrosis is a very special form of vascular damage which is seen because of immune reactions around blood vessels. What happens is there is antigen antibody complexes which get deposited into the arterial wall, and these immune complexes together with plasma proteins leak out of the cell, giving rise to a very bright pink amorphous appearance. You can see how fibrin like it is, and therefore hence the name fibrinoid necrosis. This is the blood vessel and this is the necrotic part. Lastly, we Gangrenous necrosis. Now, gangrenous necrosis is not a specific pattern of cell death, and but rather more of a clinical diagnosis. Okay, so there are two types of gangrene: a dry gangrene or a wet gangrene. So, what are the differences between the two? Dry gangrene most commonly occurs in extremities, whereas wet gangrene occurs in bowel. What is the mechanism? Dry gangrene occurs because of arterial occlusion, whereas wet gangrene occurs because there is blockage of venous drainage and there is arterial occlusion both. So, grossly, in dry gangrene, the organ will appear dry, shrunken, and black, whereas in wet gangrene, it will be swollen, it will be rotten, and it will be very soft. Putrefaction in dry gangrene will be limited, whereas in wet gangrene it will be very much, because there is a lot of blood supply in there is stuffing of organ with blood because the venous drainage is blocked, so the venous blood is getting accumulated in the organ, and therefore there will be a lot of putrefaction in wet gangrene and not in dry gangrene. There will be line of demarcation will be seen in dry gangrene, whereas you cannot appreciate that line of demarcation in wet gangrene. Since there is very limited blood supply, the bacteria will not be able to survive in case of a dry gangrene. In wet gangrene, there will be numerous bacteria and there will be a super added bacterial infection. So now you will tell me the answer for this. The type of necrosis in dry gangrene should be coagulative necrosis, and in case of wet gangrene it is liquefactive necrosis because there is bacteria superimposed bacterial infection. So how are these necrotic cells removed? These necrotic cells are removed because by the combination of enzymatic digestion and phagocytosis, and if at all, if they are not removed or destroyed, these form deposition of calcium and other materials, and this type of calcification is called as dystrophic calcification. So this is all for this video. I will see you next time in the next video. Till then, bye bye and take care.